Well, welcome to this combined ValueMed and UK drug testing product demonstration video, just showing you in more detail the ALLTEST, a 10 panel split key drug testing cup. Now this on the right is the outer foil packaging. This is sold in manufacturers' cartons of 25 tests, but individually if you buy less then you'll get a multiple combination of foils wrapped like this. The expiry date will clearly be shown on the front of these, as will the combination of the drug tests included. Now, supplied with the package that you buy will be an evaluation card which you use to determine the adulteration test strip, which is embedded into the back panel on the collection cup. We'll come to that in a minute. On the front of the cup you'll see a temperature check strip, which is your first part of the chain of custody when collecting the urine sample, and here very importantly is an indicator of the minimum fill volume that is required to run the test. Now once the test is removed from its packaging, the lid can be removed. That comes off completely, and the cup can then be given to the donor to go and produce the urine sample with the instructions to fill it to above this minimum fill volume. Now when it returns, we will show you the procedure in just 1 minute, but the lid can be stamped down and it seals with a click. That makes it unable to spill urine. The key is located in the lid. That can be removed. Now the first check that you will perform is before you run the check, just to let the temperature strip show green temperature, which you want somewhere on this scale to indicate that it's at body temperature and a fresh urine sample. The second part of the chain of custody check for the sample will be performed when we read the adulteration strip on the back. So let's show you this cup with a loaded urine sample. This cup has now been loaded with a simulated urine sample. First thing we're going to demonstrate is that it's well above the minimum fill level. Doesn't matter if the cup is completely filled with urine, but you don't want to bring it too near the top while you're placing the lid back on for fear of spillage. Now this isn't going to show particularly well on the video picture of this, but there's a very subtle indicator here at 94 and 34 degrees centigrade. Temperature square is just showing lighter on there. I'm not sure whether the video is going to pick that up. There is no square showing at 96, 98 or 100, but that is fine. It's somewhere in between that range, indicating that it has passed the urine temperature check. Now, you don't have to remove this label until you've completed and run the checks. You don't have to take it off in front of the person that you're taking the urine sample from. But we're going to do that now just for clarity, to show you that although the urine sample has been added to the split key chamber cup, it's not been triggered yet, and that no urine has fed through, and that none of these tests showing on this back panel are showing, and that the specific gravity, pH and oxidant screen has not been triggered. Now to trigger this test you just take the trigger, the key, and push until it goes fully in. The test cup should be sitting vertical in this position when that test is triggered, and you will see by doing so it has allowed an element of that urine sample to feed through into the base layer of these membranes, though the lateral flow tests are now running through. At that point you start your timer and you read it at the indicated manufacturer's read time, and all 1, 2, 3, 4, 5 columns you should see passing this pink dye upward towards where the C or control levels are indicated. So we're now going to stop the video and demonstrate this at the correct read time. We now have resumed this test at the read time for this cup as dictated by the manufacturer. First, check your 3-pad adulteration test strip. The card supplied with the cups will have a total of 6 different parameters on here. Find the one on the card that matches the 3 that you have loaded in your cup. So we're going to start with pH. Find the colour match that nearest matches the card. You're looking for a match ideally in the normal range. A colour match in the abnormal range for any of these parameters suggests you may not be screening normal healthy urine. Repeat the test on the card, finding the panel for the relevant test. This is specific gravity. Again, matches 1.015 in the normal range. And the final test, oxidants. No green or blue colour on that. The pad is slightly more brown than the white indicator on the normal range, but that is a normal test. Second, read your drug test results. Now, it is important with the 5 drug columns to have control lines showing at the top of all 5. That indicates that sufficient urine has run the distance of the membrane. And then you're looking for the presence of a T line to indicate a negative test result. The colour, density, saturation and thickness of the T lines, as you will see across this panel, varies from test to test. On single membranes like this KET and tramadol, you'll only have one test line. On the other membranes, you have multiple combinations indicated by the T1, T2, T3, and the relevant drug group is indicated on the panel above. So T1 on column 1 refers to methamphetamine, T2 to cocaine, and T3 to cannabis. These are all negative results. Do not try and interpret anything regarding the colour density, thickness, or colour saturation of your T lines. A thin, faint, or partial T line at the correct read time in the presence of a control line must be interpreted as a fully negative result for that drug group. So there you have it, a complete multi-drug screen. The urine sample that we collected to undertake this is retained in the front chamber of this test cup. So if you do decide to confirmation test or to repeat any element of the test, then you have the original sample retained, and that has not been contaminated by contact with any of the test membranes in this test cup. Thanks for watching.